The Archdiocese of Chicago is a vibrant and diverse faith community. We celebrate our faith through worship, evangelization, and reaching out to the needy. Welcome to Catholic Chicago.
Welcome to Beyond the Headlines. My name is Joyce DeRiga. I'm the editor of the Chicago Catholic, the newspaper for the Archdiocese of Chicago. And this is where we go beyond the headlines to talk to the people who are making the news that we're covering each week in the paper. And today our guest is Advanced Practice Nurse Cathlin Poronsky. I'm looking at the newspaper. This is a story that we ran. But she works in the Vicar for Priests office, and there are two nurses there who help provide care and wellness training and for our priests, retired and active priests. So we're going to talk about that ministry today. So welcome, Cathlin. Thank you for joining us.
Thank you for inviting me. I'm pleased to be here.
So can you tell us how this got started, that we decided to have nurses in the Vicar for Priests office, and why?
So Mary Kay Gaughan, my colleague, was the first nurse practitioner to be hired by the Archdiocese with great input from the Priest Health and Retirement Board, as well as the Vicars for Priests back in 2018, second half of 2018 and early 2019. At that time, the vicars were Monsignor Dennis Lyle and Father Jeremy Thomas. So there was this need to help, not direct care, but help educate, advise, accompany priests. And this was initially aimed at active priests and working to keep them healthy. So Mary Kay started in, I think it was May of 2019. And we know what happened as 2019 ended and 2020 began. So her ministry shifted from health education, health promotion, and educating priests to helping them be able to administer sacraments, particularly sacraments of the sick, anointing, and last rites to patients dealing with COVID-19.
Wow. I didn't realize she was involved in all that. Yeah.
Yes, she was. So helping priests learn how to, what we call don and doff, gowns and gloves and protective equipment. And that went on, as you all recall, for most of 2020. And as 2021 emerged and things began to relax a little bit, there was, again, with great support of both the Priest Health and Retirement Board as well as the Vicars for Priests and the Cardinal, to take a further look and see about expanding the ministry. Right now, there are a total of 664 priests in the Archdiocese of Chicago, wow. 411 active, and 253 retired. And that number is a little bit different than it was in 2021, 2022. I actually knew about this position before and during the time it was being developed. I came to the Archdiocese from my academic role at Loyola University Chicago School of Nursing. I'm an associate clinical professor emeritus. And when the job description was being written, I was consulted by a couple of people. Kevin Marslick, who's the executive director of the Priest Health and Retirement, is actually a fellow parishioner of mine at St. John of the Cross in Western Springs. So he had reached out to me and asked me about scope of practice and writing the job description and things like that. I learned in the fall of 2021 that there was going to be an expansion and that the Archdiocese was seeking to add another nurse practitioner to the vicar's office. I was a little bit interested, but I wasn't sure. But then I did decide that would be my final year of teaching. So as I was winding down my teaching, I decided to apply for the position and was interviewed, and I was hired. So I was hired in 2022. We are not direct care providers. So both Mary Kay and I were direct care providers in our previous roles. So we're not doing physical exam. We're not prescribing medications, things like that. But we are advising. We are accompanying. In fact, Mary Kay can't be with us today because she's actually with a priest at a physician's appointment. We also are out educating and providing health promotion. Yesterday, we were at a Vicariate 3 meeting at St. Richard's on the south side, and we talked about self-care and the importance of self-care. We've also tried to help priests get connected to physicians in terms of scheduling appointments or helping them when they move. So say we've got a priest that's been on an assignment in Lake County and now he's moving out to Tinley Park. I'm just using this as an example. So perhaps this priest was getting his care up there in Lake County. Well, he's not going to be able to go from Tinley Park to Lake County just for primary care or even a sick visit. So we work with helping them get established into connection with the healthcare provider and a healthcare system. I don't think it's a secret to anybody that healthcare is in a dire straits right now. There's a shortage of primary care providers. There's a long wait for specialists. I've been a nurse for many, many years, and I've never seen it like this. So we try to also help priests, as well as their families, navigate the current challenges in the healthcare system. We're very fortunate here in Chicago that we have a number of academic medical centers. And so there's really wonderful connections that we've been able to make through Mary Kay and my professional career. We've made a number of friends along the way, and we're able to kind of open the back door in some ways to help priests get the care that they need. We've also been working with adult independent living, assisted living, skilled nursing, and memory care to try and establish relationships with the facilities here in metropolitan Chicago. I don't know if all the listeners know, but archdiocesan priests do not have a assisted living facility, unlike some of the order priests, Jesuits, or Dominicans that have a facility where retired priests go and live out their remaining years. So we don't have that here. We do have one independent living residence, Bishop Line residence out in Palos Park. That's got room for 18 retired priests. But we have been working on helping make the transition when independent living is no longer feasible. How about some other questions for me? I feel like I'm babbling on and on.
That's so many priests. I mean, it seems like we need like 20 nurses. And how do you connect with them? You know.
We do see that there is room for expanded capacity in terms of us, and you're right, there's 2 of us and there's 664 priests. So there's some ideas that we have, let's just say that. Sometimes we're able to meet groups. So that's why we try to get into vicariate meetings, because that way we can meet with a group of priests. And we've been, I think, to all the vicariates this year. We try to get to Priest Day. So in the fall, for the priests are offered flu shots, so we are able to provide those there. We're also planning for breakout sessions in the upcoming convocation in June. And then we try to, this is helpful, actually, what Chicago Catholic has done to get the word out. I've been people that have been leaving me copies of the newspaper at my parish. Somebody handed me, today and said, hey, maybe you need another one. So part of it is getting word out there. So thank you.
You're welcome. What are some of the needs that the main things that you all find that the priests need and ask for? And are they open to it? Like sometimes, people don't want to share their health issues, but what have you seen? Those are 2 questions, so we can go over both.
Well, I think one of our foci is on healthy eating. And so we've done an initiative with the health and wellness team that I don't know that we've talked about that, but starting last July, we were at the Vicars for Priests conference that the St. John Vianney Center and the Archdiocese of Chicago put on every year in July, and it's held at St. Mary of the Lake, Mundelein. We heard some presentations about what is going on in other dioceses. And from that, Mary Kay and I, the two vicars for priests, Father Mike Foley, Father Kurt Boris, Father Mike Notek, who had previously been one of the vicars for priests and now is in his new and expansive role, and Kevin Marzlik, who's the executive director of the Priest Health and Wellness, Priest Health and Retirement, and Nicole Carlson, who also works with Father Mike Notek for priest development. So we were so enlightened and excited about what we heard that we decided to form a health and wellness team here in the Archdiocese. So that was last August. We've done a number of initiatives, but one of them is cooking with clergy. And I think Father Mike Foley referred to that during the interview. Yes, you can see there's Mary Kay and Father Trail. We also have a video that we're ready to release. We did a cooking with clergy. Actually, it was at my house last fall, and it's been edited, and we're ready to set that out there. We also have been working on a primer of cooking. So that's going to be ready. We hope to have that ready for the priests at convocation. So I would say healthy eating is a main initiative that we are focused on. Life in, parishes isn't what it was when you had 3 or 4 priests and you had a cook and you had a housekeeper. Those days are gone. And so many of the priests are living solo and may not have ever cooked or may not have thought that they could cook. And so we're trying to help them move forward in healthy eating. I would say the other initiative that we're really focused on is movement, exercise. Yesterday we talked about you don't need 10,000 steps a day. Actually, you have health benefits at 3,000 steps a day and moving at least 30 minutes a day. And if you can't find 30 minutes in one block of time, then 2 15-minute sessions or 3 10-minute sessions. But the idea is to get up and move. So I would say those are 2 initiatives, as well as encouraging priests to get their annual wellness physical exam and immunizations.
I know Father Foley said in the story that, you don't think about, like you said, there used to be cooks, there used to be a couple of priests in a rectory, and maybe one of them, it's a good chance one of them liked to cook or knew how to cook or something like that. But then, you're in between all these meetings and people are dropping off donuts for meetings and they're dropping off cookies and cake and, they end up at the rectory and then maybe they're in between meetings and they're driving back and forth and it's okay, I'm hungry, go through the drive-through and that all takes a toll and adds up. And, and I thought that was really neat, the healthy eating stuff. So I know you have a cookbook and stuff. We have to take a quick break, and then let's come back and talk about the cookbook and more stuff about Vicar for Priests. So don't go away, everybody.
Sounds good. Thank you.
You're welcome.
Community is core to Catholic Charity's founding mission. For more than 100 years, we have met people and families where they are, serving anyone in need, regardless of their faith, gender, race, or ethnicity. As our world absorbs the economic, political, and social aftershocks of the pandemic, 50% or more of the 6 million people living in Cook and Lake counties have little or no savings. They are a paycheck away from zero. We are deeply grateful to everyone in the Catholic Charities community who partners with us to alleviate the suffering of the people we serve and offer them a better path forward. We are witnessing a message of mercy and hope to a world very much in need. Learn more at CatholicCharities.net.
I can't imagine myself going into any other school.
Our school fosters growth by being a backbone to our family.
My kids are incredibly well-rounded. I see a lot of kindness in them on a daily basis.
One of the things I think Catholic schools do well is personalize the learning experience. You can hear joy in the classrooms.
I feel that I'm happy that I am in this kind of school.
Our school communities provide students with academic excellence and character education in a supportive and stable learning environment. Come see for yourself. Visit archchicago.org/findaschool.
Welcome back to Beyond the Headlines. My name is Joyce DeRiga. I'm the editor of the Chicago Catholic, and today we're talking to Advanced Practice Nurse Cathlin Poronsky. She works with the Vicar per Priest office, taking care of our priests and in various ways. So now before the break, we were talking about healthy eating and movement and all that. And I know that we talked about in the story that you and Mary Kay put together a cookbook. How did that come about, and what's in the cookbook, and how are you getting that out to people, to priests?
So we did the cooking event at my house, and we had a menu planned and had what we thought were simple recipes, and then got some feedback from some priests that pretty much was, well, yeah, that was a lot of work, and I don't think I'd be doing that at home. And we also tried to talk about, well, what would be something that would be appealing to you to cook? And then how would you equip your kitchen? One of the things that we came to mind about was, well, what about sheet pan cooking? Because it's so easy, and you can
Great idea.
Just have one pan to wash, and you can get a protein and a starch and a vegetable on it. So that then morphed into, well, what do you need to cook? You need pans, you need spatulas, you need measuring cups, you need measuring spoons, some basic spices. What would be, basic to have in your pantry? What should you have in your freezer? And then think about how much time do you have this week to cook, and what days would that be? Because it needs to be scheduled, right? You can't come home at 5:30 and say, I'm starving, what am I going to make now? No, that you have to plan in advance. So just what I would call some sort of basic steps. Our plan is to put this into a electronic version and give a QR code to it and have access that way. So we're almost there. That's going to be my next initiative. As I said, we had this Vicariate meeting yesterday. We have a couple others coming up. So we have several irons in the fire, I would say, but that's going to be a top priority to have this available. And we think electronically is going to be the best way to distribute it.
And you're doing these cooking with clergy events. Are you moving them around, or is it just at your house?
We are ready and willing and able. We just need some priests that want to have us come out there. It was great fun, actually. So yes, we're trying to get on the schedules of some priests and do it with 3 or 4 priests in a group. So maybe some of your listeners here could encourage that.
Well, that leads to another question I was going to ask is, what can we do to help them? I know that, some people will take stuff over to Father because, they maybe feel like making the pies once a week or something is a good thing. But what can we do to help promote the wellness of our priests?
Well, I would say rather than having it all be sweets, maybe a healthy meal. Now, I know in some some parishes, there's a rotation of women that prepare healthy meals. So, like I know in my parish, it's on Mondays, and every Monday there's a different woman on this team that will prepare, a full meal, a healthy meal. Perhaps there's a local place that prepares food and maybe give a gift certificate for that, or both Whole Foods, and I know there's a place in my hometown that they have frozen whole prepared meals, right? Maybe it's a meatloaf and some mashed potatoes and carrots or whatever, but thinking more nutritious rather than a treat. I would say that would be definitely one thing to do. In the December priest newsletter, I put a little column in there about what to do with those holiday treats and how to divide them up. And I think that there's sort of a stereotype that's what priests like. That's what they want, and it's not healthy. So we need to think what's healthy. Like, what would you feed your family? Probably not pie for dinner, right?
Right. Have the priests been open to it? Open to having you all there for your support, and for the most part, or?
Oh, absolutely, absolutely. I have felt so welcome, so appreciated. It's been stunning, actually. I have done many, many things in my professional nursing career. Yes, I've felt tremendously welcomed. And yes, many, many are open to having us be part of it. And, maybe it's like when you have a family member who's a nurse and you're like wondering like, well, this is what I heard when I was at my last appointment, and what do you think about this? And we get a lot of that too. Do you think I need a second opinion before I have this surgery? Or, I'm taking this medicine, but I'm not sure. Can you help me with the side effects? So there's a lot of that. And I think people that are nurses in their family, or people who are reaching out to the nurse in their family, that's akin to a number of ways that we spend our time.
I have a retired priest friend, and he's sung your praises many times, you and Mary Kay, on different levels. So you've been on my list for us to do something for a long time, and I'm glad we finally got around to doing it. So you mentioned that conference that you all went to. Are other dioceses doing stuff like this?
Yes. We are part of the St. John Vianney Center Care Coordinators. So that's run by the St. John Vianney Center, which is in Pennsylvania. They provide healthcare services solely to clergy and vowed religious.
Okay.
And so their care coordinators conference is wonderful. So we meet quarterly by Zoom, and then we meet in person in March. There are care coordinators is their term. So some of the dioceses or the religious orders, the Jesuits, the Franciscans, have either nurses, or some use the work of social workers in their work. I just had an email yesterday from a priest about a nurse who's a care coordinator in another diocese. And I said, oh, thanks, because I'm going to reach out to this person and say, hey, do you want to join the group that St. John Vianney Center provides? And it's very helpful in terms of sharing what we're doing in different dioceses and religious communities, and then getting some tips on, oh, well, we hadn't tried that, maybe that would be good. Or just, wow, we're all having the same struggle with X, Y, and Z, and just support. It's not a position like you would have in a clinic. Most of us, it's Mary Kay and I, and she was alone for 3 years. Nursing is a very collegial profession. I know I work best in with a group of colleagues, and so having this ability to meet with people who are doing the same thing in different dioceses is really, really helpful.
Well, it always seemed to me that nursing is a vocation, right? I mean, it's super important, and everything that the doctors come in and all that, but the nurses offer a lot of the support that that we all need when we're getting our health care, right?
Yes, yes.
Do you look at
Nursing
this?
is,
I'm sorry, go ahead.
Go ahead.
No, go ahead.
I was going to say it's been a wonderful profession for me. I taught mainly graduate students, but I did a couple of times teach undergraduate students, and I would say to them, congratulations on pursuing a bachelor's degree in nursing, because this preparation will prepare you to do anything in life. And I really believe that's true. There's so many avenues to go down to pursue a professional career as a nurse, and I know this to be true because I've done it. It's just amazing. It's a profession where you as a nurse don't have to ask permission to be there during a difficult time or a challenging situation. The door is open. We're just able to go right through that door because there's a understanding of trust. And I don't know how many years running, but it's been quite a while that nurses have been ranked as the most trusted profession in the U.S. And so I'm very proud to be part of that profession. Wonderful.
That kind of wraps it up to what I was going to ask you about how you feel about nursing and as a ministry. And I really appreciate it. I think it's a great thing that we offer the priests, and I know that the ones I've heard from consider it a huge support. So thank you.
Well, thank them, please.
So I forgot at the break, usually I give a shout out to the newspaper to explain what we do a little bit here, but if you want to check us out, we're at ChicagoCatholic.com. We come out about every 2 weeks. You can support our ministry by signing up for a subscription. It's $30 a year. And you can also sign up for our newsletter that comes out a couple times a week, and it keeps you up to date on everything that's going on in the Archdiocese. Cardinal Supich regularly writes for our newspaper. You can see what he's up to. We cover a lot of what the Pope's doing in the Vatican and really talk about and show you what the good news that's going on around the Archdiocese. And you can also follow us on social media on that, and it's ChicagoCatholic.com. So, Cathlin, again, thank you so much for coming on and for your ministry and everything that you're doing to support our priests. It's a big deal, and it's a much-needed ministry.
You're welcome, and thank you for inviting me.
You're welcome.
And I've been a long-time subscriber to Chicago Catholic. And just a funny story is I grew up in Oak Park in St. Giles Parish, and as kids, we had to sell subscriptions to what was then called the New World. And that was a time when there were 3 classrooms of each grade. And so whichever classroom of each grade sold the most subscriptions, we got a pizza party.
I love those stories. Yeah, they were was it the Crusaders? Yeah, I love those stories. So thank you so much, and thank you for your support of the newspaper. And
okay. All right.
Thank you.
Bye-bye.
Bye. Till next time, everyone. We'll see you. Bye-bye.